So I joined the Ballarat suicide prevention place-based trials back in February. I come from what they refer to as the lived experience, so I've both been bereaved by suicide as well as had my own intentions of suicide. My involvement is purely voluntary, but I'm really, I guess, trying to bring the voice of the community, and it's fantastic to be a part of that. It's sad that there's a need, but it's fantastic to be a part of that and to be heard.
The Western Victoria Primary Health Network is excited to deliver one of 12 place-based suicide prevention trials, and it's in Ballarat because there are particular concerns about the suicide rate in this region.
We've spent a lot of time interacting with the community and getting a focus for what the community actually need. And out of that, the working groups are using that information and data to be able to scope out their activities. And we're actually at a point that the activities are ready to land.
If we sit a bunch of health professionals like me in one room, we're probably going to get the same result. So this trial is trying to take a different approach, and that different approach is bringing in multiple diverse opinions, looking at data, designing projects or work plans from the ground up that is place-based and unique to Ballarat.
Part of what this trial I think will hopefully do is get more people in the community that aren't afraid to ask the question, are you okay? And have the skill set to deal with, what that person then talks about. I suppose I come from two angles. So apart from being a mental health peer worker, I'm also a survivor of suicide attempt. Anyone who's experienced mental health issues, we all have a different journey. So the more people you can get together with that lived experience, I think is, fantastic. And I'm really happy that the PHN have seen it as a vital part to the trial.
Ballarat has a challenging past, and I think there's a lot of things that need to be incorporated, but it's still got a diverse community, and there's lots of little groups that each have their own unique vulnerabilities and strengths. And part of the trial is to come up with a strategy on how we can engage those people in their own unique way.
What I feel is that it doesn't have to get to the point of crisis. When there's an isolated mother at home, just that person that comes around and has a cup of coffee with them, those things can make a really big difference to somebody's sense of isolation, I suppose.
I'm really delighted about the direction of the trial. I'm delighted by the partnership with the state government and also by the opportunity to drill down into what's really behind some of the data.
More and more people are interested in what's happening, and more people want to be involved and are spreading the word of what's actually happening. So it's actually really a privilege to be a part of something that I think is going to have a huge impact.
I suppose it took me a long time to realise that I felt that I was in the position where I could give something back to the community, that if I can sort of overcome what happened to me and live in recovery successfully, then I have that hope that others can too.